When can we begin?
At
Another
6,
5 minutes?
yeah, at 6, fine. We're expecting few more to join. Hi, Vishal. Good evening. Thank you for responding. Good evening. Good evening to each and everyone over here. I'm thrilled to welcome you all for today's informative webinar on recent advances in medical education in India. I'm Gagana Bellary, manager at Mediversal Academy, and I have the privilege of introducing our esteemed speaker for today, Dr. Alan Thomas. Dr. Alan Thomas, an MBBS graduate from CMC Vellore, furthered his education with Masters in General Surgery at CMC Ludhiana, currently working at CMC Vellore as junior faculty. He initiated his career in the resource-limited regions of Uttarakhand and Uttar Pradesh, showcasing a strong commitment to excellence. Driven by his dedication, he earned a PG diploma in family medicine from CMC Vellore. Specializing further, Dr. Alan Thomas completed a PG fellowship in vascular surgery, earning FMAS fellowship recognition from AMASI. As a proud member of ASI, AMASI, and CMAI, he is also recognized for his prowess as a presenter, having been awarded Best Speaker at GUEST 2022, Ludhiana. Thank you. Over to you, Dr. Alan. Alan ji? Dr. Alan ji.
Yeah, hello, good evening. I'm here, just settling a few things here before we can start. And I'm really happy, to be here. And I hope my video is now clear and
Yes,
my audio is loud and clear. Thanks, Gagna, for that introduction. And
thank
I'm
you.
really happy to hold this free webinar for everyone here, and especially for our mission hospital friends who are different, in different parts of the country, and where definitely academic front is quite weak. And I hope this platform will help you, all of you, to grow academically. And I love taking these webinars, especially for my mission hospital friends. And God bless you all. And today's topic that we are looking at is recent advances in medical education in India. So if you look at a lot of things here, now our main focus of today's lecture is how we can transform healthcare training through innovation and technology. Matlab, looking at what it is also like a career guidance class for many of you. Right. And just a second, I'm just trying to shift my slide. Just some. So to start off with, we have the objective, okay, to mainly to explore the advancements in medical education in India, to understand how innovations are shaping future healthcare professionals, and importance is the India, you should understand, is a hub for healthcare talent. And quality medical education impacts the global healthcare outcomes. Although if you are well educated, it will not improve your own education. At the same time, it will affect the lives of people outside also. You know? Yeah. So how did the medical education evolve in India? So if you look at pre-independence, traditional methods based on Ayurvedic, Unani, and ancient systems. Then post-independence, more of establishment of institutions like AIMS has come in. And if you can see, focus on its structured MBBS programs. Now, what are the recent trends? integration of technology, competency-based curricula, and global collaborations. So AI has been really introduced into this program. Now, what is the traditional teaching versus CBME? Now, what is CBME? I will come in the subsequent slides. So that's a competency-based medical education. So if you look at the curriculum part, you have the educational objectives and you have the assessment part. All right. Then you that is your traditional model. And then let me see if I can get a pointer here. Yeah. So educational objectives and you have an assessment. You study and then you give an exam. That is your routine curriculum. Now, how it's been improved is whatever is the needs of the society, needs or health system, then there are competency outcomes. Then you have a curriculum that is made out of it, and then finally you have the assessment. Right. Then if you look at competency-based medical education, it's actually a learner-centric approach to medical education that aims to create a new generation of Indian medical graduates who are equipped with knowledge, skills, and attitudes to function as primary healthcare providers. Now, what is the curriculum of CBME? It's outcome-based. What are you actually wanting it from the studies? Outcome-based kind of teaching. Early clinical exposure, then you have an internal assessment. Okay, then you have what happens is previously clinical exposure used to be quite late, so now then they have early clinical exposure, then internal assessments, some talks on professionalism and ethics which have been improved. Now if you look at the pyramid, you look at the subset lowest point. First is your MCQ exam, means your theory. Basically it's your theory, you know the topic. Then you have know how to apply it. Okay, it's extending matching or multiple choice questions. Then you have whatever you have learned comes in the shows. Okay, that is your standardized patients, and finally or assisting, and then finally you have the procedure that you faculty observation audits and surveys by doing what you have already learned. So first is knowing, then you are kind of you knowing how it works. Okay, and then shows how is mainly assisting, and then understanding, and you have standardized patients manage, and finally you are doing what you have learned. Okay, this is Miller's assessment pyramid. It's taken from the American Board of Internal Medicine. Now, it was implemented by the NMC in 2019, focus on skills, knowledge, and attitude development. What are the key features? They were mainly on holistic development, complete development of the candidate, longitudinal program to improve clinical reasoning and problem solving. Now, what was technology integration into it? Now, basically VR reality and augmented reality. Now, what are these things? These are mainly AI-based systems. Virtual reality, using, when a doctor wants to perform surgery, he would first want to practice the surgery. So he will have an augmented reality or virtual reality things where he will be practicing the surgery not on the patient but on the similar model as of the patient, and then find out with what procedure, what cut he makes, or whatever incision and the procedure he does, what would be the outcome of the model. So that is your virtual reality and augmented. So if he has to correct any method, then he can do it virtually, and then finally before coming on to the real patient, he will be ready, he will be already ready and perform the best of the best. And personalized learning and patient simulation. So what happens, as we all know, many of your doctors here, be it Ayush or be it MBBS, there are many of you have seen anatomy being have learned anatomy also on patient bodies. So there's something known as newer ones called digital anatomy lab. Very few in places have it, and virtual patient cases that are there. It actually enhances your clinical decision making and reduced dependency on live patients. So sometimes if you make an error on the virtual patient cases, no one dies actually, or does not have a bad outcome. However, you are more equipped to treat live patients once you practice on these models. So this is something known as a digital anatomy lab. It's a huge screen. No cadaver is not there. So whatever you want to learn, especially this is a bone model, as you can see from head to toe. And based on that, whichever region they want to do, it's a touch screen thing. So it's called the digital anatomy lab. So this is how they learn anatomy. And here you can even rotate, try and mobilize virtually, of course. See the back of the board. You can see in the views, angles. So now there were some studies. Well, a medical student versus dental students, whether chalk and blackboard method is better or PowerPoint presentation is better. As you can see, PowerPoint is blue, chalk is almost reddish, and your overhead projector, okay, like the slides kind of thing, overhead projector, that was it. So based on that, if there were some parameters that were understood, and they said lecture contents were more informative when it was on a PowerPoint presentation. This is among the medical students, and they were able to take better notes or diagrams when it was a PowerPoint. Delivery was interesting, and still simulated interest. So these newer technologies actually improve. So whenever you are in a teaching position, whenever you have to teach your juniors, if you use a PowerPoint method, it will be more, lectures were audible, lectures were well organized in a PowerPoint presentation, and your student will grasp more. But so you should understand, when you're in a teaching mode and you have to teach your juniors, try to use technology to make them understand 3D models or like that. So this is the study that was done among medical students and dental students in a medical college in India. However, for the completion of the study, for medical students, they felt that it was better with PowerPoint. However, the dental students still felt the chalkboard method was definitely better. Now, if you look at what we have started among Mediversal series, I'm very happy to have some clinical these photos, and um, just some snapshots where there are different case studies. Okay, where you have initially the history, then you have very very readable physical findings. Then you have some tests that have been indicated, and of course the patient profile and vital signs, which is a part of your examination. So based on that, you come to a conclusion, what could be the case, or what could be the problem. So these have been, and you can always register for our, case series, which is again free of cost, and learn more from them. And definitely, I'm sure people in the mission hospitals and very different, many of you may be manning casualty alone, managing small nursing homes or small hospitals all by yourself, and where it is very important to be the best of what you are and treat patients to save their lives. So this is one of the major aims of Mediversal Academy, just educating you, upskilling you so that you save lives and grow in your career. Of course. Use of AI in healthcare, very, very important. So this is one of the research papers, real world proof of concept clinical evaluation. So automated detection of diabetic foot ulcers, which is a major problem in many of the places in India. And as you can note that, there's these diabetic foot ulcers that are there. Somebody is drawing on the screen. I request, please don't do that. And real world proof of concept and clinical evaluation that is there. So before, maybe as soon as the ulcer is in a small stage, the detection is very good. And or also it looks at a lot of patients where they are prone to form diabetic foot ulcer, so prevention mode is very high. Yeah, this is kind of a VR system. Now, what is the focus of telemedicine and digital health? Many of you would be involved. So it is now integrated into curriculum in many places, training in telemedicine platforms, how to manage protocols, and exposure to digital health tools like electronic health records. And the significance is building the healthcare access gaps in rural areas. So our lectures try to, reach up to the many people who are in the rural areas, who are really, working hard day and night to, so, save patient lives, give them a good healthcare thing. So focusing on digital health and telemedicine. So if they are finding it difficult to contact the doctor there, they try to call up the city and through telemedicine and digital health. And of course, it's a future digital health scenario being being prepared, because many times you may or may not be able to reach the hospital. okay, considering the risk of infections and difficulties. So basically, you should say COVID-19 really pushed everybody to go into this e-learning and simulation and AR and VR technologies, of course, and telemedicine and digital health. Now, what were the global collaborations? There's some examples. So there were international universities for exchange programs. This was also integrated into curriculum. Having international, scholarships for exchange programs. WHO modules were incorporated into curriculum. Of course, someone from India going abroad and abroad coming here, there's a cultural, there is understanding, difference of understanding global healthcare systems, what is being taught there, being taught here, and the amount or I would say the strata of patients that they see in India versus they see abroad. How is it different? The disease profile is different. Okay, some places may be endemic for certain diseases. Tuberculosis, for example, may or may not be seen so much with so much frequency as abroad, and vice versa. So, research opportunities and funding has been brought in at many places. So, if you look at research and innovation in medical education, there have been advances, dedicated research modules during MBBS, how to do research, startups, and funding in healthcare education. Now, there were some case studies like AIMS initiatives in telemedicine training, collaborations between IITs and medical schools for bioengineering research. Now, what was the focus on mental health training? Very, very important. If your mind is not in place, then nothing is in place. So that was quite a recent inclusion of understand because a lot of doctors and staff were going through difficult times and stress period because treating lives or saving lives, treating patients is not easy. The person who's treating also undergoes so huge stress, whether the drugs that he's giving, the care that he's giving, will the patient be all right or not? Handling relatives. So all that has been taken a huge toll on mental health, which has been a recent inclusion and has become a key part of the curriculum. So training on handling stress and emotional intelligence. What is the outcome of the same? Preparedness to address the rising mental health issues in India. Yeah. Now, upskilling initiatives for faculty. There have been programs like faculty development programs on pedagogy or hybrid learning, digital tools. What is the outcome? Enhanced teaching standards. So now the faculty is trained enough, the doctors, the senior doctors are trained enough to teach well because you also undergoing certain classes and understanding how to teach, then definitely your student engagement will improve. The students will be interested in your classes, and of course they will improve in their overall career. So similarly, looking at just an example of Mediversal Academy, these are some courses that are there that they provide on fellowships and diplomas. So what are the challenges in implementation? Of course, newer things, newer challenges. Some people may not agree to changes. Limited access to advanced tools in rural medical colleges. So that may, because of cost issues, because of internet issues, whatever, high cost of integrating the technology, resistance to change from the traditional methods. One of the primary problems that we all face, and solutions are increased government funding, public-private partnerships, faculty training programs, and what are the government initiatives? The what highlights establishment of new aims. Government has been very, very kind enough to have start aims. Some reforms from the NMCs focusing on increasing the postgraduate seats. Now, addressing the shortage of healthcare professionals, the government has taken really good initiatives. However, still they are short on, on taking the thing, but they're slowly from what was the thing 5 years back to what is now definitely they have really focused on increasing the seats, ensuring uniformity in medical education standards, having regular inspections, future prospects. Now, what are the predictions that we have? More of AI-driven curricula. Now you put anything on ChatGPT or AI-related servers, they will give you an answer. So for expansion of online learning modules, continuing medical education, integration of genomics and personalized medicine training, so, looking at this, I thought I will put across a case study of an edutech company and how it has really transformed medical education sitting right at the comfort of your home and upskilling people. So, that is Mediversal and is pioneering medical education for tomorrow's innovators. So just a quick thing on Mediversal. This is a case study that is based on this lectures. And if you know, it's about empowering healthcare professionals. The three main things that you can see: nurturing excellence, medical mastery, and healthcare advancements. So if you're looking at Mediversal stands as pioneering and prominent name, and medical mastery is here, influencing entity in the realm of medical education. And of course, when these two fall in place, healthcare advancement does happen. Now, the wide range of courses that they have. Earlier, this was just not available only, but now you have to go to the library, sit hours and hours, and find out or browse through the net. And some of them would be paid, some of them would be free. Nothing available. You have to refer to multiple sources. So if you look at, say, internal medicine, or looking at broad specialty, emergency medicine, sports medicine, oncology, so these complete family medicine. So these are totally online. Content has been already. Videos are there. It has been already prepared. So 50 plus esteemed faculty and some of our innovative instructors, as you know, they are from abroad. And so our content is mainly from Harvard, John Hopkins, Warren Alpert Medical, Yale University School of Medicines. So these are the people professors from here have taken lectures for us, and which we provide in the courses. And Indian faculty and course guides that are there, who are there to help you. And they hold webinars, they have these doubt solving sessions. Apart from this, so what? Apart, one's not just learning or upskilling; they also help you get some placement. And placement in the terms, it may not be always with stipend, because without stipend, is there something to upskill yourself? You get an experience certificate, and of course, some places are there with stipend. So that really, helps. Like the placement factors. Many of you have post FMGs and you want clinical attachments, and look forward for joining hospitals with some stipend, and you can kickstart your career. So you learn from our online program, and then you are placed at different hospitals throughout the country. We have about 55 plus hospitals. And what are the benefits of this Mediversal online thing? Of course, many of you are aware, Up to Date subscription, which is like a complimentary access, and this has got enough and more of data. And whenever you can also quote your latest treatment, it gives you a treatment pattern, whatever you are doing, whether you're right or wrong, or how much, what is the latest data that is evidence based medicine, so that even if you go to court for any, you have to answer whether your treatment was right or not. And if you are doing it as per Up to Date, it is the latest data that is available of evidence based medicine, of your clinical decision, what drugs to give, any clinical condition that is under the sun. So, yes, of course, we have these free webinars, mentorship programs, and faculties there, learning management, e-learning program is there. And of course, my favorite is the Up to Date thing that is very, very good. I've personally used Up to Date, and not just me, many doctors, if you have heard of Up to Date, or if you have even doctors would have foreign doctors or Indian doctors who use Up to Date on a regular basis to understand the clinical scenario, or the tailor their treatment. So this Mediversal Academy's courses, they have CPD credit hours, and e-certification is there. And hospitals, if you're really interested in clinical attachment, we will attach you. The Mediversal's team will attach you to the hospital. And yes, case-based learning, as I previously also showed, it will always keep you active and academically. So wherever you are, whether you're in the city or in the rural, it just Mediversal is there to enhance, upskill you clinically, right? And most a good number of people are from our post FMG. candidates who are waiting to get some clinical attachment, who want some upskilling thing. A good number of doctors are from Ayush background who just want to learn for the love of learning. They have, enrolled with us. We don't restrict our learning or content to any persons, preferably to the doctors. Is what in allied health is what. Of course, we give the content to them, and so that it's like a learn thing for everybody, and we would be really happy if for you to you upskill yourself. So it just doesn't come with upskilling, it comes with a lot of affiliations and esteemed certifications, something from Government of India, and of course UK CPD approved, and the certificates that are provided by Mediversal. And in case you want to go abroad, and you may have to verify your certificate through Ministry of External Affairs, called apostiling. So when we provide the certificates, it is that it is already apostilled by Ministry of External Affairs, and yeah, that's what one of our USPs are, and we give it to them. So one step less that needs to be done. So these are some hospitals, and you can see you wherever you are, we will find a hospital near you. And another thing, one really important thing is if any of you are working in hospitals, or you have consultants in that hospital, and you want to attach to Mediversal's hospital network, we are most welcome and open for hospital partnerships to get along, and definitely look forward to provide the staff for the doctors for the hospitals. So if you're a struggling mission hospital, or you're struggling um, hospital where you really are on the verge of closing down, and you're really you need help, we provide the funds to with the doctors as a clinical attachment, for training them at that juncture. So yes, we have 55 plus hospitals, of which some of them are mentioned in the map. We have grown over time by God's grace. And yes, to conclude, medical education in India is definitely witnessing a paradigm shift from the pre-independence to post-independence, and of course, advancements are enhancing quality and accessibility. A good amount of things are available online for you to learn and upskill yourself. Now, embrace the technology and global collaborations to drive the progress. Yeah. So these are our references, and I hope. How do I solve a mission hospital? This is just another scenario where hospital through medical education, and so we start providing fellowships. We start uh, medical education wings at different hospitals. Academic um, setups at different hospitals who have only patient care now want to start off an academic front, want to accept. So we have a ready-made system where we have approvals from different places, and where we can immediately start off. So if any of you are starting have hospitals and want to join Mediversal Academy, and or hospitals who don't have an academic front, like you want to start off say small term lab allied health courses or anything, we can start it off immediately, and you can start enrolling the candidates at the earliest. So definitely you can always call us back on the helpline number or the website, or drop in a request. We'll always look up to it. And educational wing is feasible at each mission hospital, or a Christian mission hospital, or hospitals that are in the rural area who really need help. And we are willing to help the hospital in any way that is possible, uh, as per our capacity, and provide doctors, and provide medical education. We will do the best we can. Just you can plan to associate with us. Thank you. So some hospitals really wanted doctors, and then we put in advertisements, and this is, yeah, that's the summary. Thank you.
You, Alan.
So yeah, do we have some questions? We can always have career-based questions. And just let me know if Mr. Jha Saab is here. Has Sir joined?
No, I don't.
Yeah, Mr. Jha, has he joined? He is one of the extreme, very well-known assessor we had. I'm not sure, he's probably caught up with something urgent this evening. I requested him if he was around, he could just join. So if he's around, just say hello. So yeah, the floor is now open to questions. Shoot your questions, and this is more like a career-based or competency-based kind of lecture. How we can, uh, provide the best to all of you, and how we can improve the lectures, and yeah, how can we upskill you so that you do better in your training and when your patient care. Of course, many of you have good experiences with working in difficult situations, resource limited situations. Okay, many of you are experts, but you need to always upskill yourself, and you need to know what is the latest evidence based medicine, and we strive to teach you evidence based medicine. Yeah, and of course, Gagna will definitely be available for your questions, and always feel free to ask of any interesting like topics, or not just topics, or you're interested in certain subjects. You can always enroll with us to learn more about it.
Kindly drop your questions in the chat box. We'll do the best to answer them. Class. Thank you, Dr. Sushil Kumar. Additionally, I'm dropping a link in the chat box for you to fill and submit to get your participation certificates. Kindly fill and submit.
I do see a lot of old faces.
Yes. Familiar faces.
Yes, who have been very diligent with our
Kevin.
lectures.
Exactly.
We do have this regular webinars at least once a week or twice a week. We do strive to have, and we have really good faculty who take on different topics. I think the next one would be on an echo, I believe.
Yeah, the next one would be on
Very, very
neurocognitive.
much basics of echo, understanding how to read an echo.
Yes.
Very, very useful, especially when patients walk in with already echo. You need to know whether it's a high risk patient or low risk patient. Basics of echocardiography, very, very important to any emergency medicine person or any MBBS person who's manning casualty.
Yes, the next webinar is on neurocognitive disorders, echocardiography, and on gastro and toxicated health and environment.
Wow, January is packed, I believe. One of the lectures I'd be taking would be how to manage diabetic ketoacidosis, which is like a medical emergency. How to manage them, how to identify it. So I hope to see all of you there. Yeah. And Gagna, are you offering anything on New Year?
Yeah, we'll be offering some more discounts. We'll be launching soon.
Thank you, Dr. Ishrat.
So stay updated. Like we'll be launching our office in our Instagram. Kindly do follow our social media handles.
Thank you, Dr. Deep.
So there's no questions. I guess it was crystal clear is what Deep Sutar is saying. Thank you, doctor.
And Happy New Year to all of you.
Happy New Year. So Alinji will wind up.
Yes, definitely. If there are no more questions, and definitely please offer them something from my side.
Yes, we can give Alan, like we can give 10% off. They can use Allenton as the discount code, coupon code.
Especially for the people who have attended this
Correct.
lecture.
Sure.
Thank you, Dr. Shivani. Thank you, Dr. Ishrat. Thank you, Dr. Mir. Shall we then call it a day and enjoy?
Yeah.
Oh, yes, somebody
Thank
from
you all.
Gambia. Thank somebody from Gambia. Thank you so much.
Sure. Thank you all for joining us today. We hope you found this webinar informative and valuable. If you have any further questions or would like more information, please feel free to reach out to us. Additionally, we'll be dropping, I've already dropped a link in the chat box for you to fill out and submit to receive your certificates of participation. Don't forget to follow us on social media for updates on future webinars and events. Have a great evening.
Thank you.